We're into week 4 of lockdown and people are asking questions. When will we get back to a real sense of normality? What's the end game? Have we picked the right strategy for fighting COVID-19? Well, here's Liam Bartlett with some answers from overseas which aren't all easy to accept.
In Sweden, they've taken a different approach to the rest of the developed world in tackling the nightmare of COVID-19. The streets are busy. Businesses are operating. Restaurants and bars are open. And primary school kids still go to classes.
We haven't shut down the whole society. If authorities would recommend that, we can make that decision. But it's even better if we can get normal people to actually act sensible and use common sense to actually have a society working long term.
Home Affairs Minister Michael Damberg is helping oversee this typically Swedish approach to the crisis. Here, social distancing is suggested, not enforced. Only the elderly and the vulnerable are in lockdown. For the rest, it's life pretty much as normal.
If we don't have a society that works, then the healthcare system cannot work. So you have to strike the right balance here. And if it doesn't work, we're ready to make new decisions.
It's a high-stakes move toward herd immunity, to slowly spread the virus through the healthy population. The country's death rate per capita is already higher than that of the US. If it all backfires, the cost in lives could be immense. One of your newspapers described the way you were doing this, your model, as playing chess against death.
I think all countries are playing chess with a new pandemic that we haven't seen before. But so far, the healthcare system copes. It is a strain. It is a very difficult situation. But so far, the system has worked in Sweden.
Whether or not the Swedish experiment continues to work remains to be seen. But political scientist Bjorn Lomborg sees it as an example of the terrible trade-off we all need to make.
If you are successful in reducing the death rate now, what you're simply doing is you're going to see a higher death rate later on. I think that is actually what the Swedish authorities are doing right now. They are accepting to have more deaths right now because it'll also mean fewer deaths in the future. And at the same time, of course, it'll mean less economic damage.
It's a very grim cost-benefit analysis, isn't it? Perhaps the ultimate one.
It is. It totally is.
Professor Emma McBride is an infectious diseases modeller who's been crunching the numbers on the delicate balance we now face. She says one option we have is carefully allowing the infection to spread in select low-risk groups so we can get at least part of our society functioning properly again.
One of the answers could be in the fact that COVID-19 behaves differently in different age groups. It appears that children are not only less vulnerable to severe disease, they also may well be less infectious and less likely to become symptomatic.
So as an infectious diseases specialist, you're saying perhaps it's schools for young children?
Young children may be the key to getting out of lockdown, yes.
It's a controversial idea, and there's plenty we still need to understand before we could fill our classrooms again. But microbiologist Professor Peter Collignon believes it's worth a shot.
All the available evidence around the world is children under the age of 15 rarely get this and rarely get complications.
So you would start with schools perhaps, open them up and see how we go.
That might be the first good experiment. And we just see, does this work?
Whatever strategies we adopt, for now, we all have to stay the course and make the most of our incredibly restricted way of life, hoping that the steps we take keep us moving in the right direction. A future that will take us back, as much as possible, to where we once were.
I think what Australia is doing, which is halfway between letting it all rip and completely closing down, is so far a much more a sensible approach, other than I think some of the states have gone too far.
It's a very difficult game, this, isn't it? I mean, I don't mean that in a flippant way, but it's hard to know who's right and who's wrong, and we just haven't got the history to back up any decisions.
Look, I actually think none of us know how this is going to go. But I don't think we can become all hermits for the next 2 years. I mean, what is our end game? My presumption is our end game is to have low transmission in the community so that, yes, people will get it, unfortunately, but we'll identify them quickly, we'll identify those around them, we'll stop it spreading further.